I'm announcing today the next step in our cross-government approach, and these include temporary public health restrictions at the border. And let me explain why we are bringing these forward, as other restrictions have, of course, finally started to ease following 2 hard months of lockdown. The answer as to why we're bringing these measures in now is simple. It is to protect that hard-won progress and prevent a devastating resurgence in a second wave of the virus. We are following the science and introducing public health measures that are supported by SAGE. This will require international arrivals to self-isolate for 14 days. That is the incubation period of the virus, so that if people have become infected overseas, we can limit the spread of the virus at home. And as we are taking this action, we are taking it at a time when it will be the most effective. Passenger arrivals have been down by 99% compared to the previous year. Now we are past the peak of this virus. We must take steps to guard against imported cases, triggering a resurgence of this deadly disease. And as the transmission rate across the United Kingdom falls and the number of travellers arriving in the UK begins to increase, imported cases could begin to pose a larger and increased threat. This is because they could become a high proportion of the overall number of infections in the UK and therefore increase the spread of the disease. So with far fewer people being infected in this country, and with the public having worked so hard to bring the R number down, any new arrivals entering the country with the disease during this next phase will have a much bigger impact, potentially causing a second wave.